Okay. Hi, everyone, and welcome back to another session with DentalShadowers. Today, we are joined with Dr. Rosen, a general dentist, who will be showing us more about her daily life. Dr. Rosen, the floor is yours.
Thank you. Hi, guys. I'm excited to be here, so thank you for having me. I am in Boston right now, so if anybody's in Boston, what's up? Everyone else, what's up to you too, but Anyways, so what I was going to do today is just run through a bunch of different things. I've got, how I decided to become a dentist, my path through dental school, my path through undergrad, of course, and also kind of what I'm doing now. So we have a lot to get through, which will be fun. So let's go to the next slide. So here we have a beautiful photo on the right side of the page. That is my dad. He's also a dentist in Delaware, and we're wearing our matching Snoopy scrub caps. Now that dentists, I used to wear my hair just, in a ponytail during work, and now I see how much splatter gets on everything because of a face shield. So all of us are, wearing scrub caps every day, and these ones are really cute, and I like matching him. It's very fun. We don't work together though. For undergrad, I was at University of Delaware, and I majored in, I live right next to a fire station. I'm sorry, you might be able to hear that. I went to University of Delaware, and I majored in exercise science. I transferred actually there. I started out at BU in Boston. So if you transferred, totally fine. Not a big deal. Makes it a little bit more exciting, I'm sure. For a gap year, I worked in a dental lab and took some other classes. So we'll talk about that a little bit more later. I did dental school in Boston as well at Tufts and loved it and finished up in 2019. And then I did my residency at Northwestern Memorial Hospital in Chicago, and I did what's called a general practice residency. So we can talk about that as well. All right, next slide. During college, so I've got a photo here of University of Delaware. I lived right next to this part of campus. At some point, me and my friends convinced ourselves that we were the first people after graduation to jump in the fountain with bottles of champagne and take cute photos, but I think that we're making that up, but I still like to think that I originated that. The most important thing is to pick a major that you enjoy. There are a million majors out there, and it doesn't have to be pre-dental, pre-medical. It doesn't have to be bio. I hated bio. I thought it was the worst. If you like bio, that's amazing. But if you don't worry about it, especially if you are a freshman or a sophomore. Pick something that you like. When I was at BU, I started out as a chem major and was totally overwhelmed by it and didn't really like it, didn't study enough, hadn't really figured that out yet, how to be productive studying. And then I transferred and tried out international relations, and I took art history classes. I took so many other fun things, and I ended up with exercise science, which I loved because it was an interest of mine, but also covered a lot of important topics that you need for school. But don't sweat it. If you want to be an English major or a journalism major or whatever, it's totally fine. I do recommend taking hard classes in the summer. Labs in the summer, great idea. If you study abroad, I studied abroad in Hawaii and didn't do much studying. And I know it's not technically abroad, but I did take an ecology class and it counted as a lab science. So if you're looking for an extra lab, consider something like that, because you'll have required classes, but you'll also maybe have one more that you need, like a basic science lab that you need, and things like that can count as well. And you can get a lot of recommendation out of it as well. So you will hear a lot, just so you know, when I was at Tufts, I interviewed prospective students to admit them to Tufts Dental. So a lot of this is coming from experience of what we were looking for at the time. So, you can take it a little bit with a grain of salt, because it might have changed a little bit and it varies from person to person what they're looking for, but this is what I found to be important for sure. People that are well-rounded. So if you hear that a lot, and I think that it's important because if you were in, let's say, Greek life all of undergrad, well, did you ever become a director of anything? Did you ever take that extra step to show that you were really good at being in charge of things? If you were part of another club, maybe freshman and sophomore year, you were just a member of the club, and then take on some more responsibility. Don't be intimidated by it. Everyone who is in the executive board position was in your same boat at some point. And I think that it can be intimidating, but it'll be a big confidence boost to you afterwards when you realize it was totally fine and doable. Specifically showing interest in healthcare and dentistry, I can't emphasize enough. I interviewed people who were, smart, obviously, and, had a lot to offer, but they had shown absolutely no interest in medicine or dentistry. And when you're up against a lot of other really competent applicants and you can't show that you ever along the way looked into this, it's a really expensive and long path. And they want to make sure that you have vetted yourself to say, okay, I volunteered. What I did, for instance, it wasn't dental necessarily, but there was a hospital right next to school, and I volunteered in the emergency department for 2 years at least. And you need those volunteer hours, so that checks that off. And I got to work with patients all day. I had some fun stories, and it gets you more comfortable. Like when an alarm goes off in the building and your heart starts going, like that's something good that you recognize that you work well under pressure or whatever it is. So anyways, recommend that. And I talk about this a little bit later, but if your grades are lower, that's okay, but you need to fulfill the rest of these things. I didn't have a 4.0 GPA. A lot of people who applied to dental or medical school don't have a 4.0 GPA, but they showed that they were so busy doing great at so many other things too. And that does matter. So just make sure that you've, looked into that and push yourself to do that little extra bit. For instance, I don't know why I put this on there. I helped start a dental club that donated, I think, dental supplies. I couldn't tell you what the name of the club was, but I remember during my interview to dental school, they asked me a lot about it. And I could say, yeah, because I love dentistry and I thought it was worthwhile. And I remember them liking that, but it wasn't something I stuck with, but it was something that was worthwhile for me when I was in school, and I enjoyed it. And I met a lot of other pre-dental students, and it was good. Anyways, so next slide. So during college, I put this up just because I think it's worthwhile to keep in mind. I know that people are probably all over the country, but if you want to look at dental schools that you would consider, like potentially consider. I mean, I think I applied to 11 or 12 schools all over the East Coast and like Midwest. But if you think to yourself, I know I want to end up in one area, or I probably want to stay in the Northeast or the Southwest or wherever you are, I would look up some dental schools and just see what their requirements are. This is Tufts, but they're mostly going to be the same across the board, give or take a couple. Like, I think that biochem wasn't, maybe not required for everything. Microbiology, some schools wanted, some schools didn't. But it's important to keep that in your head, because I ended up taking that gap year and taking those 2 extra classes and studying for the DAT. So I think keep your eye on the long goal, because you might not have an advisor in school who is doing that for you. And while they should be helping, you can do this yourself, and it's pretty easy. You can go to like their admissions page for the school, and it'll come up at some point. So, next slide. So during college, I don't know if people still call it a victory lap. I thought it was funny. I thought it was endearing. Makes you feel better when you, a lot of people want to go straight from undergrad to dental school. Don't worry about it. Totally fine. Take that gap year, get better grades, don't stress yourself out, work, make money. I went into dental school with a little bit of savings because I spent that year working, and that is very helpful. When you have a bad week and you just want to treat yourself to something, totally fine. So I took that victory lap year. This is a side note. I didn't know where to put this, so I just added in. Community college credits usually do not transfer. I haven't heard of one dental school where they accept them. So if you're hoping to take summer labs at community college, don't do it. You will, if they don't accept them, I would bet that a school that does accept them, and I still don't know of any, I would bet that they would be more likely to choose someone who did it at a 4-year school. I think that that's just across the board kind of the consensus. So keep that in mind. I studied for the DAT when I was in my victory lap, and it was great. I felt like I could put 100% of my focus into it. I think I studied for 2 or 3 months, I want to say. Maybe it was less than that, though. I don't really remember. I'm going to be honest. I just remember it being a summer that I spent, and summer was like 3 months. So that's why I think it was probably 3 months. And I want to say I did the Kaplan class. I don't know. Crack the DAT was probably a thing then. But don't stress out. I will say that as I was probably one of the younger people in my class in dental school, and I still took a year off. So don't feel pressure. Don't feel like you're going to be so old when you get into dental school if you take a year more off. I got lucky. I only had to apply one time to dental school and got in, but the majority of my classmates, a lot of people had applied multiple times. I had a friend that it was her 4th cycle applying, and she is a fantastic dentist. So it doesn't mean anything if you don't, go straight through or do that, but stick with it, and don't stress out if you end up taking a gap year and retake a class or whatever it is. Next slide. Oh, this is where I circled back to, you don't need a perfect GPA for dental school, but you do need to make sure that you are ready. Like, even think about it now, totally fine. And think to yourself, when they say why you don't have a 4.38, 3.9, you can say, I studied really hard, but it was also really important to me that I TA'd this one class, and I was really involved in this club, and that took up a lot of my time. And I have really good hand skills. I'm really into painting or whatever. And I know that while I'm not the best memorizer or whatever it is, I have everything else that it takes to be a great dentist. So totally fine. I was never the smartest person in the room, but I work really hard, and I knew that I checked a lot of those other boxes, and I think that they like that. So during dental school, okay, these pictures are so fun. I found these on Google because I didn't have any photos that were appropriate from dental school. It was all like us like sleeping in the library or like, I don't know, drinking to celebrate being done an exam. So during dental school, you couldn't pay me to do it over, but I enjoyed myself. I think that that's a good way of explaining it. I met fantastic people. It was great. Again, I was at Tufts in Boston. Really recommend it. There's 3 schools in Boston, which is kind of interesting. It's more than any other location. But these 2 photos are ones that we found on Google, and I'm pretty sure both of them are my classmates. Like, I know the one on the bottom is definitely us. And dental school is notoriously stressful, and one of the big pushes recently has been to work on mindfulness and mental health, because it is stressful. I will tell you, I developed super anxiety during dental school just because of the pressure that you put yourself under and the pressure of being successful. And I've learned how to manage it, which is fantastic, especially because you can relate to patients better if you've been through something like that. But schools are doing a great job of helping you also facilitate that. So I love that also. The top photo is kind of cool. It's from what is called the Simulation Clinic. And in SimClin, you'll see pictures, there's stuff like this on Instagram, where you see people with these, the kind of like those crash dummy heads, and then the fake mouth, and you can stick like a suction tube in the back, like a throat, and you've got your air water syringe and your hand pieces and everything, and you do a lot of your clinical exams there, because this really simulates a face. And I remember, and you didn't hear this from me, but we had these like awful like sheaths that we put over their heads to make them look realistic, and we like named them. I think mine was like Headward or something. And if you could cut the sides like the Joker, and it made the mouth open way more so you could see things. So anyways, great times. So study with your friends. That was so helpful for me. You can quiz each other. It makes you feel better. If one person is learning faster at something than you are, you can definitely help each other and teach each other things. It's good for repetition. I wasn't at the top of my class academically, but my one of my best friends was like top 3 in the class, and it was really nice to study with someone who was like, you get this, and then we'd get the tests back and I was like, well, you got it clearly. But it's okay. I excelled personally doing the clinical work rather than the academic work, and that's okay if that's you too, because when you get out, no one's going to ask you what your GPA was. They're going to say, are you going to do a really good job on this tooth? And the answer is, yeah, really good. I TA'd, I did all the right things. I got honors. So important stuff. I would recommend living close to school, by the way, because you spend so much time there. When you walk home at 2 a.m. from school, you don't want to drive 35 minutes. You will absolutely be miserable. So anyways, next slide. Choosing general dentistry. So there's a bunch of, I'm sure a lot of you guys have heard this or looked into it. You've heard of orthodontists if you had braces. You've heard of oral surgeons who took out your wisdom teeth, probably periodontists do gums. There's all these different specialists in dentistry. I like everything, and I enjoy being a general dentist, so that's what I chose. I can do any procedure that I feel comfortable with and don't have to do the ones that I don't feel comfortable with. So I don't like taking out bottom wisdom teeth, so I never have to do that again. But I can take out any other tooth in the mouth, and I'm like, I'm great at that. That's fine. You can always specialize later. So I know that there is a dentist in my hometown in Delaware she was a general dentist for like 20 years and then became an endodontist who specializes in root canals. And that's cool. It was obviously something that they really liked. I also have a couple friends now who are 2 or 3 years out of dental school and are now going back to become pediatric dentists or endodontists because they found that that was what made them happy and that's where they excelled. As a general dentist, though, you can work only 4 days a week if you want. You can work 3 days a week if you want. It's a really great lifestyle. You can make your own hours within that if you want. It's very flexible as far as work goes. So if you're still on the fence about choosing dentistry, do it. You'll love it. You can be your own boss, but you can also not if you want. If you want to own your own practice and want to be responsible for that, more power to you. I definitely want that for myself, but a lot of people don't. A lot of people want to show up, do a job that they love, and then leave at the end of the day and are just like, I'm out. Great, do that too. That's totally fine. There are so many companies and dental offices that would love to hire you to do only that because they want to do that part of it. Where I work right now, I'm in a practice like that where I just show up and do my job and love it. And I love my coworkers and then I get to leave. So it's kind of cool. Getting to know your patients over time is something that is unique, I think, to general dentistry, probably pediatric dentistry too, just because you see people for those visits every 6 months. Some people come in even 4 times a year. They come in every 3 months for a cleaning. So you end up forming relationships with them that are really great. You're a little bit therapist, a lot dentist, and it's wonderful. Like you get to meet people, like all of a sudden they send their fiance to you, or they really liked you and they know that their mom needs work done, and all of a sudden you meet their mom and it's so fun. You meet their kids. So I love that part of my job. And it's very rewarding. Once I decided to become a general dentist, there is something that is optional in dentistry. So that's very important. If you're still in college and you keep thinking to yourself, do I want to be a dentist or do I want to be a medical doctor? Like, which way do I want to go? This is actually, I think, one of the bigger differences, besides the fact that we're so focused in the mouth, and that could be any part of the body if you do like the MD or DO route. We have optional residencies. You don't have to. When you're done 4 years of dental school, you are licensed. You are done. You can't work in New York. Fun fact, New York, if you want to work in New York State or Delaware, where I'm from, there's a couple places where you do need to do a residency. I'm trying to think if there's any other places. There's a couple funky states that have like certain rules, but those are the 2 big ones, especially on the East Coast. You need to do a residency. So I did a residency. I would recommend it regardless if I were all of you. And I think that the trend is becoming that residencies, if they are never going to be required, I don't know, but they're becoming more competitive because people get so much out of them that they're worth it. You should do it. I did mine at Northwestern Memorial Hospital in Chicago. I chose it because it was a really big program with a lot of work to do, but only 2 residents. So I was going to get more experience. And I decided you can do anything for a year, and I wanted to get my butt kicked. And that's exactly what happened. It was a lot. I was on call every other 24 hours and every other weekend. So when people ask me, oh, how did you like Chicago? I don't know. I didn't leave the hospital for a year. And I was attached to a pager that went off at the worst times of the day. And I ate a lot of hospital food, even though Chicago supposedly has really good food. But it was so worth it. I did rotations in oral surgery, radiation oncology, anesthesia, and the emergency department. And that is consistent for all general practice residencies. So this is more information than a lot of you need. So I won't go into it. GPR versus AGD. AEGD is a different type of general dentist residency. It's not hospital-based, it's clinic-based. So it's kind of like another year of dental school, just working in like just a clinic. But anyways, I put this in there because I think that it should be on everyone's radar as something that you should just get kind of used to the idea that you should do this, that dental school is just 4 years, but that 5th year will catapult you and you will get more confident and you'll be more productive in private practice when you're done. So it's worth taking that salary hit for a year working as a resident because you'll be a better dentist. So anyways. Let's look at some residency examples. Okay, so I wish I had more examples. I chose a couple that I had found in like the depths of my stash because I deleted, I think, a lot of them earlier this year and I shouldn't have, my mistake. But anyways, let's look at this example number 1. I don't remember the details of all of these patients, but the gist is there so you can get an example of kind of what would happen. So it's 3 a.m. and you're sound asleep. And it already took you 1,000,000 hours to fall asleep because you were worried about your pager going off. Totally a thing. You're staring there like, please don't go off. And as soon as you fall asleep, it goes off. I think I heard my pager, like a phantom pager noise for months after I was done residency. Like you hear a beep and you're like, oh God. So it's 3 a.m. and your pager goes off. It's the emergency department. ED is the emergency department. And they say that they have a 45-year-old male with a large lump on his cheek. And he says that he's had tooth pain for a while, but this just came up out of nowhere, he feels. So you tell them that you want a CBCT, and a CBCT is a 3-dimensional X-ray that is becoming a gold standard for dental offices to have. It can be used to take both panorexes, which you guys have probably had that, if the thing that goes around your head. Now, instead, they do both. And CBCTs are just a really great 3-dimensional option. And you go into the hospital. And then you consult your oral surgery resident who's on call that night. And what they ended up doing for this guy, this is really interesting. So let's say you have a broken tooth in your mouth and it hurts at first and then it stops hurting and you don't think about it because maybe you just had a baby or something and you've got a lot of other expenses and you're like, I'm going to put this off. It doesn't hurt anymore anyways. You hear it all the time. People are like, if it doesn't hurt, it's not a problem, right? Wrong. Once it hurts, sometimes it's a bigger problem than it should have been. So you've got your tooth, okay? And you've got the roots of the tooth down here, okay? And they're in the bone and the infection forms around the roots down in the bone, okay? And if that infection gets big enough, it will work its way slowly through the bone, through the gums, and you get a tooth infection pimple, basically, okay? So Dr. Pimple Popper, that kind of stuff, this is that, but it's caused by a tooth. We do them all the time in residency. Like, I cannot even tell you. I told the emergency department staff that I only wanted those 3 a.m. calls if they were going to be juicy ones, because you get people come in and they're so swollen and you have to incise them and you put a drain in. And those are the pictures that I deleted. I'm so annoyed with myself. But this one had gotten to the point that it was so big that it had to be done from the outside. And so the issue with that is that it leaves a bigger scar. But the good news is that it's immediate relief for the patient. And generally speaking, if you take care of it for the person and then you take the tooth out, the infection totally resolves because the tooth is the source of the infection, right? So once the tooth is gone, or a root canal or whatever it ends up being, it goes away. So anyways, this was kind of cool. This was, I think, the only one that looked quite like this. The other ones that had to be done from the outside by oral surgery, because general dentistry, I do the ones from inside the mouth, but they do the ones from the outside. And the rest were usually like people get really full on the bottom and then they have to do like little things down here. Anyways, so I hope that's enough detail. If this stuff, by the way, this is so important. If this stuff grosses you out, that's totally fine. I remember before dental school thinking that the first time I took a tooth out, I was going to hit the deck. You would not believe how nervous people are to give their first injection. Totally fine. That does not disqualify you from being a great dentist. You get desensitized over time and it won't gross you out as much anymore. So if you're one of those people that was like watching this and all of a sudden had to like click to a different screen, that's okay. You know, I think that I know a dentist that told me not that long ago that they really hate the sight of blood. They're still a great dentist. I know that they're wildly successful actually as a dentist. So don't worry. But if you do like these, enjoy. Okay, so we'll go to the next one. So this is really interesting. Another example from residency. You get a consult from HEMONC. Okay, HEMONC is hematology oncology, and HEMONC is the people who actually this wouldn't have been HEMONC. Who would this have been through? Radiation oncology, because radiation oncology are specialists who work on if you have cancer and you have like a cancerous mass. HEMONC does like chemotherapy. Radiation oncology will do the radiation. And so they'll plan that radiation treatment, which is really cool. I got to do a rotation with them. And they show you exactly how they map things out. They try to avoid all of these really important structures, which is really, really cool. And the way that it connects to dentistry is that, let's say, so this is an example, this person is about to have head and neck radiation because this is cancer, this is oral cancer. And if you can see how big it is, it actually continued, it was in the back, far back right of their mouth, and it continued along their jaw under those bottom teeth that you can see, those mandibular teeth. So yes, exactly, it keeps going. So all of that needs to be removed, okay, by oral surgery or ENT. And those are head and neck surgeons too. So our role is that if any part of the mouth gets more radiation than a specific dosage, then the bone doesn't heal itself well afterwards, and you are likely to get osteoradionecrosis. You don't need to know any of this, but it's kind of interesting if you do want to look it up. Basically, it's a bone infection because the bone's not going to heal well if they need an extraction down the road. So preemptively, we'll say, listen, you don't want to deal with both of those things. So let's take out the teeth that are going to get too high a dose of radiation, and that way, later, if this cancer's gone and you're living a happy, healthy life, but you have a tooth problem, you don't need to worry about something else down the road, because that can be really bad. And people who get that infection really badly can end up, they can end up having big parts. Like I've seen people who have to have parts of their jaw removed because of that infection. And that's not what you want to have happen after. So that is why we do this. So we got a lot of consults during residency for management of this. You know, you also, people who have head and neck radiation have significantly dry mouth if the radiation goes through a salivary gland. What else? It can affect the muscles and the jaw joint. So I saw a guy one time who couldn't open his mouth literally more than like this much. Okay. So if he needs work on one of those back teeth and he can't open his mouth more than that, a lot of the philosophy of, people that I worked with who had a lot of experience with this was, let's take out those back teeth because we're never going to be able to do a filling on them, and we won't be able to get the tooth out because your mouth isn't going to open. So anyways, kind of interesting. This is oral cancer. Cool. Next one. This one's kind of nasty. This is what a mouth looks like when it's missing a bunch of teeth. And I was consulted because they think that the patient's cancer returned because he stopped eating. And they basically just wanted to rule out mouth issues because of eating, but they were pretty convinced already that it didn't have anything to do with the mouth. They were incorrect. I think I'd never followed up with the patient, so I don't know what happened, but that he definitely had stuff going on with his mouth that was making him unable to eat. And all those little white patches around his teeth were because he had a denture in for who knows how long, that the facility that he was staying at or whoever he was being taken care of didn't know he had a denture, hadn't helped this guy take it out. He didn't say anything about it. He might not have been, of the mindset to be able to verbalize that or even like aware anymore. A lot of people who have dentures don't sometimes they feel like they fit so comfortably like an old shoe would that they think to themselves, I don't need to take it out, or I don't need to whatever. But cleaning them is so important. And this is a prime example. This guy had incredibly severe candidiasis, which is a mouth yeast infection. So when I tell you I walked into the room, it smelled like a brewery. Like, it was one of the craziest things I've ever experienced. So it had gone down like his oral pharynx, and like it was everywhere. But it burns. It's not fun. It covers your tongue. I think I had another picture of his tongue, but like it just looks like these little white spots, and they rub off, which is how you know it's candidiasis. Yeah, so not fun. But anyways, I thought it was kind of a cool photo. And it's fairly easy to fix. You can give a lozenge or a mouthwash, but people who have really dry mouth are also predisposed to this. So maybe an older person who's on medications, who also someone who had head and neck radiation. We'll connect things. All of those things could lead to it. So next slide. Okay, so what I'm doing now. So after residency, this is me at work we have an office dog. And when I tell you that this dog both drives me nuts and I'm obsessed with her, it's both things. Her name's Gracie. She's wonderful. That scrub cap, I shrunk in the wash. I really liked it, and now it doesn't fit. I just ordered some new ones from Etsy though, so it's worth it. Star Wars themed. So patient exams, I do a lot of those. That's really fun. That brings us a little bit back to what I said about getting to know your patients. It's a good way to, just say, how are you doing? Like, not even with your mouth, like, how are you doing? Because someone who is happy and things are going well is probably also more likely to take care of their mouth. Someone who's depressed during a pandemic, I can't tell you how many people are like, what's not been happening? I'm not brushing my teeth. I get it. We need to get you to do it, but like, I get it. I do a lot of fillings, which don't bother me. I think that as I get busier as a dentist, I will do less fillings, but it's also part of being a general dentist. I do a lot of crowns, fewer bridges now. I did a lot of bridges during residency. Bridges are where you have two crowns with a suspended crown not attached to anything. It's a fake tooth in the middle. Removable are things like dentures and partial dentures. Invisalign, do a lot of Invisalign. Botox and fillers. So I don't do them myself. A lot of dentists are doing Botox, especially for TMJ, your temporomandibular joint stuff. Like the clenching muscles in here, if you put some Botox in them, it can provide relief for patients. And fillers are something that I know a number of dentists do, and sometimes it's more associated with a dentist who might own like a med spa or something. But, I think it depends. The rules also on doing that depend on the state that you're in. So if that's something that you want to do when you're out, that could change, I guess, where you think you want to practice. I don't know. You don't have to do it. A lot of dentists don't, but some do. endo, I do root canals, and I love seeing emergencies. I think it's really fun to not know what's coming in. When someone comes in, you have to play detective. I really enjoy that. So I enjoy emergencies. So next slide. I have a couple examples from a mix of residency and private practice now of cases. So these are all dentures. So the top one, this patient came in and those were their teeth. And as you can see, you know, they had really shifted in like a spreading out sort of manner. And I see that a lot with patients who have bone loss. When there's less holding the teeth in, they tend to migrate in that kind of pattern where some of them come out. All of his teeth were really loose. They had to go. So we gave him a beautiful set of dentures. And you can see, I like seeing how genuine people's smiles are when you see the after, because they're just so thrilled. I love that. The woman on the bottom had a really old worn down denture, and she had a bunch of implants that had been placed in a different country. And it was really fun to figure out how to integrate making a new denture with these unique implants also, because you have to find parts and stuff like that. So that was really fun, and they were thrilled. And she actually didn't speak any English. And so she always came in with her best friend who was her translator. Oh God, they were the best. And actually the top patient too, he didn't speak any English, and his wife would come in, and it's so fun. You end up getting to know people through just like, you know, hand motions and using Google Translate. And, you know, you really have to like people to be a dentist. I mean, you don't have to, but like, it helps a lot. So we can go to the next slide. Crowns. So I like the one on the left. I think it's a good example of, you know, yeah, so that's the one on the bottom is the fake one. And you can't really tell. That's what I like to see. I don't want a patient to ever feel like they're walking around with, to be fair, I don't have a picture of what the tooth looked like before. That's now the prepped tooth on the top. So it's like you have an M&M. This is your tooth M&M. You take off the green part of the M&M. The insides are the same. So that's the insides of the tooth. And it's sensitive because it's a little bit softer than the outside of the tooth. So you have to put temporary on it anyways. But when you put the final on it, usually the patient feels great, and you want it to look real because that's what patients like too. The ones on the bottom, the one in the middle, I inherited this case from someone before me, and those were all temporaries. And so we kind of redid things for them and ended up making these beautiful crowns, and they were thrilled. And then the one on the bottom right was really fun. The bottom photo I took, it was kind of still in progress when I left. They were tweaking the shade of things, and they wanted to do their bottom teeth as well. But yeah, they looked literally beautiful. I was so thrilled. And I think that that's one of the things that I like most about dentistry is how you can really make someone's confidence so much higher, because, you know, teeth are, you use them to eat and they need to function really well, but they also can look really nice too, and people feel good about that. So I like that combination of things, functional aesthetics, you know? So the next slide, composite. So composite is what your fillings are made out of. So if you have fillings between your teeth, great. It's important for you to chew on. But this poor girl came in and she chipped her front tooth right off. And she said that I think she had like a Zoom meeting or something that was like right then that she had to deal with, and said like, sorry guys, gotta go. And we really fixed her up. It looks great. And this is a little bit different because you're not sending it to a lab. When you're doing it composite, you're really doing it by hand yourself. It's a little bit more artistic. If you plan on doing something like bonding, and bonding can be a way without, crowns are made of porcelain generally, or other things, but we'll just say for this that they're made of porcelain. The lab is fabricating them. When you're doing composite things, you're fabricating them. The lab can say, we recommend this shape, but the colors are up to you, the texture is up to you. So it's really fun, and I enjoy it. Not all dentists like to do it, but I don't mind it. So the next couple slides, the next two of them. So I know that Instagram is really important for communication these days and figuring out what you like to do and what you don't like to do. These are two people, the next two slides are people that I really like admiring their work, because for me, I think that I set a benchmark for how I'd like my work to turn out. And so it's fun for me to look at people and say, oh my God, that's what I want to do. So I really like this guy. He's based in Boston. He's a ceramicist, super talented. I love looking at his work and saying, I wouldn't know that that was a crown. So anyways, this is what I enjoy about dentistry, making things that look so natural that nobody knows that it's dentistry. You know, if the patient wants teeth that look fake, great, we can do that too. But if they don't, we can do that too. So that's really fun. I like this guy. I think that it's great. I've heard he's also a really nice person. And the next slide, this guy is, I think, from Wales, but I really like his work. He does a lot of stuff with composite. So if you're really artistic and you are into sculpting or art classes or whatever it is, and that's something that you're drawn to in dentistry, you might want to check out his work. He, right now, there's a company that's actually based out of Chicago called Cosmodent, and Cosmodent has a lot of continuing education videos on their website. They also make materials, and they make really nice materials, but he's doing some lectures for them. And while you don't need to worry about going to people's lectures, it might be something that if you're looking to just get inspired and keep yourself motivated, this is a great way to do it. You know what I mean? It's nice to have role models. It's nice to have people that you aspire to be as good as you think they are. And if maybe you're getting closer to getting into dental school or going to dental school and you do want to watch some videos, do it. That sounds good. You know, it's kind of fun to just know where they are if you need them. I don't know. So I think that that's it. Yeah. So if anybody has questions, please feel free to message me. I do respond to everything. I get made fun of because between patients, I respond to people. But yeah, it's really, I can't tell you how much I'm happy that I chose this as a job. I was lucky that my dad also loves it. He's also a general dentist. So I was lucky to have a role model of someone who is thrilled at what they do every day. So I also feel lucky. You know, it's not for someone who, you know, if you don't, I don't know, it's not, if you don't like artistic stuff, if you don't like working with people, if you don't like a challenge, it might not be for you, because it is really hard. It's really challenging. It's a lot, but I couldn't be more thrilled myself with my decision. And as a female dentist, it's really fun too. And it's nice that it's flexible in certain ways, because I think that that's important too for women. Like if you think you're going to have a baby one day or whatever it is, you know, sometimes things like that are important to think about too. So anyways, I'm babbling now. I'm done.
You're good. Thank you so much for your informative presentation. If that's okay with you, we'll get going with some questions that we have here.
Yeah.
So our first question is, how important is it where you go to undergrad?
Where you go to undergrad? Oh, that's a great question. I would have had a totally different opinion of this going into school. I would have, I went to both a private school and then I went to a state school, and I knew people that in dental school that I had never heard of the school that they went to. And then I had one of my best friends in my class went to Harvard and Johns Hopkins. And you know, I don't know that you can get a better name than going to Harvard for undergrad. And he was in the same class as someone who I had never, this guy went to this tiny school that had like 500 people total. So I wouldn't worry about it too much. I think your performance and that resume and talking about like showing that you're interested is really important. The other thing though that I would consider doing, and I don't know if this will work, but there's never anything wrong with asking. You know, if you are like concerned about an application, call up the admissions office of the school that you're applying to. But I don't think that it's something that I would overly worry about, as long as you're kind of ticking those other boxes along the way and showing that you're a go-getter and you're, you know, doing all the other stuff. I wouldn't worry about it.
How did you overcome the stress of dental school and residency?
That's a great question too. I think that you just kind of work your way through it. I had a really great support system. My parents were really helpful, but I have friends that I leaned on a lot. I'm a very social person, so I feel like knowing that I need people around me, but I also need downtime to recharge is important. So recognizing what you need is good. You know, if you are the type of person that knows that you go to the gym to de-stress at the end of the day. Well, during dental school, maybe you don't want a 4.0 GPA in dental school, or maybe you want to go to a dental school that's pass fail, right? Maybe that's something you want to look into, because that does exist too these days. And I didn't go to one of those, and some of them are. And I just remembered that. And so that's actually a good point. But recognizing what your own limits are is really important. When I was dealing with my anxiety stuff, and it's something that looking back, I recognized I probably had in dental or in undergrad as well, but didn't like recognize what it was. You know, what I wasn't doing in dental school was giving myself the time to recharge between things. I thought I could just keep going, but really, like, I'd rather do a little bit less well academically to be a more competent human overall. And that's my own personal choice. So I think that those are all important things. You know, if you don't feel like you have a good support system, though, then I would figure out a way to facilitate that for yourself. You know, join clubs, do something that you feel like you can find people that are similar to yourself. And also, you know what is such an important thing? Get a therapist. You know, if you feel like you're really stressed out and you don't have someone to talk to about it, and you're stressed out through the application process, like during dental school, get someone that is on your side that you can have as your advocate to say, you know what, how could we change things here to do that? So I think that as a medical professional, you need to advocate that mental health throughout all of this is going to make you a better provider for your patients. If you're stressed out and overwhelmed, the people that are relying on you won't have you available the way that they need you. So,
Why did you decide to major in exercise science?
oh my God, I don't know. I was never like the craziest athlete in high school or anything. And actually, my best friend's mom was my lacrosse coach. And when I told her that I majored in exercise science, she laughed at me. She's the best. I love her, but it was still very funny because I don't know. I just loved it. I found it really interesting. I was with University of Delaware had and still does, I think, one of the best physical therapy programs in the country. And so I was with a lot of physical therapy students, and I enjoyed learning about the body overall and how it works. And I've always been into fitness, even if I wasn't like most like athletic. I think I'm just not competitive really. But yeah, I think that it was just something that I enjoyed that also fell within the range of covering a lot of those required classes. So it was kind of a win-win. But if, like I said, if you really like art history or, you know, something else, geology, that's okay. Just know that you might take a fifth year and might be busy every summer taking other things. So exercise science, great though. If you're looking for a major, you know, things like kinesiology and there's probably like introductory courses. You end up learning stuff about like physical training, which I thought was really interesting. And the people that are in that major usually are pretty cool. It's a pretty chill group. People just like to, you know, take care of themselves. A lot of nutrition classes. So look into it if you're still undecided and feeling kind of lost. You might enjoy it. Or you might not. I don't know.
No. Did you get paid as a resident?
Yes, and that was a little bit something that I wanted to be cognizant of as I chose a residency. It's a little bit hard. The ones that pay you more are the VA pays really well and is usually a pretty good program. They're more competitive because they pay well and you get good benefits and all these things. And I don't think that usually they have too many residents. If you're looking for the residency certificate, but you don't want to work that hard and you don't want to be on call as much as I was on call, for instance, you can choose a program that has more residents, that might have like 12 or so residents, but you probably will get paid less. So I think it ranged anywhere from 40s to, I think that I made $62,000 the year of my residency, which I didn't save any money living in Chicago, but it paid for my rent and paid for hospital food for the year. If you're someone who's going to graduate with loans, I recognize that that's a different burden. And there's a couple different things that you can do to help with that, but I still would consider doing the residency, even though you're going to be making less money. There might be a way that you can like postpone your loan payments until after the residency is done. But your school will be able to help you with that or whatever. But I think I made about 60.
That's cool.
Yeah.
Would you consider specializing in the future?
I've thought about it, not right now, but I really like endo, which is root canals. During school, I thought that I would want to be a periodontist, if you had asked me then, who does like gum surgeries and implants and things like that. I think my interests have changed a little bit. I really like aesthetics. And I really look forward to owning my own office one day. And I like the idea of having an office that is just this really welcoming general practice where people want to keep coming back to because they are well taken care of. And if I'm a specialist, you get sent a patient that one time to do one procedure, and you really never see them again necessarily. So I think that I would really miss out, for me, on something that I really enjoy. So I don't feel overly pressured right now to do it, but it's something that in the next few years, if I change my mind, that's okay too. Usually you can make more money if someone is financially minded, you can make more money as a specialist, but you a lot of times have to pay for the residency also. You're not getting paid during residency. Some of them do. Oral surgery, you definitely get paid because a hospital employs you. I don't know, it kind of depends a little bit on the program, but just know that that's additional. That could be an additional like $200,000 to $300,000 that you have to pay. So it's not like, I'll just do a residency. It's like, no.
Yeah. I hear a lot of dentists talk about continuing education courses.
Yes.
Where do you find these, and how long are they, and how much do they usually cost?
Oh my God, there's no one answer to that question. I do have one answer. There is basically it depends, I think, a little bit on your state, what the specific requirements are, but each year or every 2 years, I'm going to mess it up a little bit. There's a requirement for how many CE points you get per every 2 years, and you have to turn those in to keep your dental license. So I think for me, it's like 40 points every 2 years. Credits, sorry. So it's not difficult necessarily to acquire them, but you could do it off of only free classes. And if someone's really like jonesing for some CEs already, you could probably find some free ones online yourself. They are everywhere. ACT Dental is a company that I've watched some of theirs over the pandemic, and they do free courses, and you could learn about like the business of dentistry if you wanted to. They do a lot of stuff like that. But then you can take ones that there is like I know there's one in Boston where you can get certified. It's months long. I think my friend who's doing it said that it's over the course of like a year. It's one like 3-day weekend a month for a year or two. And it's $15,000, but you learn how to place dental implants, and you probably get like 200 CE points doing it, like something like a lot, right? I did one earlier this year that was a few $1,000s because it was a big course. So they can be expensive, but I got a lot of CE credits for it. And then you can take ones that are free and you get 1 or 2 credits, and it's usually like a credit per hour sort of thing. But it's just something that everyone pays for. You don't have to pay for them if you don't want to, but sometimes the more popular classes are $100, and you'll go to a convention. There's dental conventions in all the big cities. The one in Boston is Yankee. New York City has a huge one at the Javits Center called the Greater New York Dental Meeting. And that's every Thanksgiving weekend. And because of my dad, I've been going to that since I was like 5 years old, every Thanksgiving. And it's really fun. And there's hundreds of vendors. So you get to walk the floor and try out every dental thing that you could ever want and more in your life. But you also take classes if you need CEs. And so there's like, you walk into this huge convention center and there's just like tens of thousands of dentists. It's kind of this like weird situation. So that's what you can do.
Would you say that you are an introvert or extrovert? If you were an introvert, how did you try to come out of your shell and build your bedside manner?
Yeah. So I've taken the test. So I know that I classify as an introvert, but only because at the end of a day, when I've talked to people for 10 hours, I just want to sit by myself and not talk to anyone. That being said, it's a good question for those of you who are like legitimate, like, I think it's like an outgoingness thing. Like I'm very outgoing, but if you're not outgoing, I think that what I would think about if I were you is that nobody wants to be at the dentist. Nobody wants to be at the dentist. You, from the time that your patient walks in the door to the time that they leave, this is your chance to show them that taking care of their health is really fun and rewarding. And, if you're just as nervous as they are, they're not going to have a good time. Come up with those cheesy jokes. I have a really cheesy joke actually that a patient told me the other day that you guys might think is funny. She was 85 years old. And I sing the whole time. Turning on music in an operatory can really help because it gives you something for you and the patient to talk about. We have a Amazon Alexa in all the operatories in my office. And when the patient sits down, if it's someone who's really quiet and doesn't really know what to say, I'm always like, do you want to choose the music today? And they always say, no, whatever you want to listen to. And I go, no, I insist. I've chosen it the whole rest of the day. You will be doing me a huge favor. You have to pick it. And if they're still like, I don't know, then I give them options. I say, well, do you like the 60s? Do you like the 70s? Do you like the Hamilton soundtrack? Because we can listen to that. I'll make a joke and I'll say, you want to listen to WAP? And like, if it's someone our age, they usually are like, hee. But I think that you get better at it. You get more comfortable once you realize that the person in the chair is way more nervous than you are. And there's all different types of patients out there, right? There's patients that want to come to someone like me who can talk to a brick wall for 12 hours straight. Okay. I don't need anyone to respond to me. I can just talk and talk. But there's some patients who don't want to come to someone like me. They want to sit there, zone out, and not hear a peep and listen to classical music or jazz or something for the 45 minutes that they're in the chair. And that's okay too. So don't think of how you are as something that someone wouldn't really enjoy. Just know that you might eventually want to cater your office to suiting a specific type of person. Like use that to your advantage. And if you do have someone else that walks in the door that's looking for something else, then you can use the same thing for every outgoing patient. What kind of music do you want to listen to? Great. Did you have a good week? Do you have a dog? There's certain things that you just like become formulaic. So I wouldn't worry about it too much. I think your confidence builds as you get there.
Thank you. That's all the time we have for questions, but we really appreciate you taking your time out to come and speak to us.
Thanks, guys.
Informative presentation.
Yeah, thank you so much, Dr. Rosen. We really enjoyed having you here today, and we really love the pictures of your cases. Thank you so much for everything.
Of course. I hope they were okay.
Oh, no, yeah, for sure. All of our viewers love the cases, so thank you so much for including those.
Of course. Thank you guys for facilitating this. I know it's like a lot of work for you guys too, and I'm sure you've sat through a lot of them at this point, so you're like well shadowed at this point.
Oh, but it's like something new every day, so we thoroughly enjoy it.
Awesome. Well, if you guys have any questions or you're going to be in the Boston area, please let me know. Happy to help you in any way that I can.
Thank you so much. And for everyone that's watching, Dr. Rosen's Instagram handle is right here if you guys would like to keep up with her or ask her any questions. And Kathleen actually already just posted the attendance quiz in the YouTube chat, so you can either click it there or you can also find it in the Linktree or on our GroupMe. And yeah, thank you so much everyone for joining. Make sure you guys tune in for tomorrow's session. And I hope you all have a great night. All right.
Becoming dentist, you can do it.